Yeah, great. Hello, everyone, and welcome to Clearing the Plate webinar. I am Shalu Ramchandani. I'm one of the doctors at the Benson Henry Institute of the Mind Body Medicine Center and on the Mass General Cancer Center Lifestyle Medicine team. And I am so excited. I'm going to introduce Ashley and Carol, who are going to be talking about a lot of things that people ask, the same questions that come up for people all the time, all these questions around dairy. Should I be eating soy? Should I be eating dairy? And they're going to help us clear all of these myths, right? So it's going to be a great hour. So Ashley Draviam is a senior clinical dietitian. She's board certified specialist in oncology nutrition, and she has worked at the MGH Cancer Center for 10 years, including with the lifestyle medicine program to provide individualized nutrition care for cancer patients and survivors. Ashley is certified as a qualified bilingual staff in Spanish and enjoys connecting with patients and families from all backgrounds to help with the nutrition through their oncology journey. And she spends much of her free time in the mountains and the outdoors. And she also loves traveling, cooking new recipes, teaching her two young daughters about foods like sardines, okra, and jackfruit. I haven't tried jackfruit yet, but anyhow. And then Carol Sullivan is a registered dietitian with more than 15 years of experience practicing as a certified specialist in oncology nutrition at MGH as a senior clinical dietitian, and she feels fortunate to work with many people and their loved ones undertaking the scary world of cancer diagnosis and treatment. Her pragmatic and individualized approach to nutrition has helped many thrive the challenges of treatment and often confusing time after treatments are completed. She offers individual and virtual group visits as the lead dietitian at the MGH Cancer Center Lifestyle Medicine Program, and the program is offered to patients on the survivorship continuum, incorporating the pillars of lifestyle medicine, which include healthful eating, being physically active, managing stress, getting adequate sleep, and then having a strong support system. So with that, I'm going to let Ashley and Carol take over.
Thanks so much, Shalu, for that wonderful introduction. Can we have the slides up, please? Carol, are you able to share those slides?
Sure, I can share the slides. Sorry, I thought Shalu was going to share them today.
I can.
Can you share them for us?
Yeah,
That'd be good.
Share them too. I wasn't sure. Okay. Sorry, we didn't decide who was going to share them, but that's okay. So here we go.
Thanks, Shalu.
Can everyone see that?
Yeah.
All right, I'm just going to get rid of my other screen since I wasn't planning on.
Sorry about that.
No, you're fine. Hang on 1 second.
Cool.
All right. That's good.
All right.
Okay, we're good to go.
Go to the agenda slide. Thanks. All right, so today we are going to be diving into some juicy topics related to cancer and nutrition, including sugar, fasting, soy, dairy, the ketogenic diet, whole foods, plant-based diet, including the gut microbiome. And then we'll talk about how to find credible nutrition information and provide you all with some nutrition resources. So these are, as Shalu said, things that many of you probably have questions about and that come up frequently in our practice. And before we get started diving into sugar and cancer, I just want to talk for a minute about how simultaneously complicated and simple nutrition information is. And what I mean by that rather contradictory statement is that there are some basic nutrition principles or tenets that we know can improve health and prevent disease. And this is based on years and years of research. However, nutrition research can be incredibly challenging to do because everybody is different, right? We have different genetic makeup, different preferences, different bodies and sizes, different predispositions for disease. And so it's hard to control for all of these variables that impact the outcomes we're looking for in this nutrition research. Media likes to take research and run with a big catchy headline, right? That's what gets clicks and likes and gets people to buy books. But we know that there are lots of nuances in nutrition research, that it's not black and white. And so our job as oncology dietitians at MGH is to take this evidence, all of the science, the research, the information that we have, to understand the nuances and to apply these to each individual patient that we see. And so what we hope that you'll come away with today is a bit more nuanced and a better understanding of some of these rather complicated topics, and a better understanding of the kind of simple nutrition breakdown that we recommend for promoting health and preventing cancer. So let's dive into sugar, because sugar is probably the most common topic that we get asked about almost on a daily basis. How many of you out there, raise your hand in your home or your office if you have heard the phrase sugar feeds cancer, right? We hear that probably almost every day. A patient walks into our office and asks about that. So let's talk about some of the facts. Carbohydrates are one of the primary macronutrients, carbohydrates, protein, and fat, that we eat. And carbohydrates in food turn into glucose in our body, or blood sugar. When we eat carbohydrates, our blood sugar goes up. A while after we've eaten, our blood sugar starts to come back down. That's a normal, natural process. That is what's supposed to happen in our bodies. Foods that contain carbohydrates include fruits, starchy vegetables like potatoes, peas, corn, grains like rice, quinoa, pasta, and breads, beans, lentils, dairy, which some people aren't aware contains carbohydrates, and then, of course, sweets like candy, cookies, and ice cream. What's important to note here is that cutting out sugar or glucose in your diet does not restrict glucose from getting into cancer cells. So our bodies have to have some glucose present in our bloodstream at all times in order to keep our brains working and our muscles working. So if you don't eat foods that have carbohydrates in them to break down into glucose, your body will convert other nutrients from protein and fat into glucose, again, to keep your body going, to keep your brain going. It's also important to note that foods containing natural sugars like fruit or grains or dairy can provide really important vitamins, minerals, fiber, and phytonutrients, which are these plant-based nutrients or chemicals that can help prevent cancer. On the flip side, added sugar is something that we don't really need in our body. For most people, excess added sugar should be avoided most of the time. It's okay to have some added sugar, but basically it's not providing us with a whole lot of nutrition or anything meaningful on a nutrition front. I say for most people because the caveat here is that as oncology dietitians, we are working with a wide variety of patients who are going through cancer treatment and after, many of whom are having a very hard time eating because of the side effects of their treatment or of their cancer. And so for those patients who are losing weight or having a hard time getting in nutrition, added sugar can actually provide an important source of calories and energy. So is sugar something to limit? This is the question that we get a lot. Sugar intake affects insulin production. And we know that insulin is both necessary for life to keep our cells working and is also a growth factor. And chronic high intake of added sugar can contribute to excess insulin production and excess body weight, which have both been associated with an increased risk for cancer. So what's the bottom line here? eating small amounts of added sugar is not going to directly feed your cancer cells. If you have a cookie, that sugar is not going straight to those cancer cells to make them grow. It's much more complicated than that. But at the same time, in general, with a few exceptions, we do recommend reducing the total amount of added sugar in our diets. It's important to note that fruit does not count as added sugar. That's something we get from patients a lot, coming in saying, I've cut out all fruit because I heard that sugar feeds cancer. And as we talked about, fruit can provide myriad benefits health-wise. And then I just want to point out this label here. So as of a few years ago, the new nutrition facts panel is required to include added sugars in foods. So whereas we used to just see sugars and people would be very confused about what that means, now it's separated into carbohydrates, total sugars, and total added sugars. And we don't want to focus so much on the carbohydrates or the total sugars as the amount of added sugar. So it's important to read those labels. Yogurt is a great example of this because yogurt does have total sugars in it. But if it's plain yogurt, it doesn't have added sugar. That's natural sugar from the lactose or the carbohydrate naturally present in yogurt. Whereas if you have a flavored yogurt, some of them have up to 20 grams of added sugar or 5 teaspoons of added sugar per cup. So it's really important when you're looking at products that have a nutrition facts panel that you skim down and look at those added sugars and compare different products.
So insightful. Thank you, Ashley. Okay.
All right, moving on to fasting and cancer. Fasting is definitely a hot topic these days. We hear a lot about it for weight loss, for blood sugar management, and increasingly fasting has started to enter the cancer space. There are many different types of fasting diets. I'm not going to go into the specifics of these, but time-restricted eating is a common one. This is where you limit the amount of time that you eat in a day to a certain number of hours. There's 5-2 fasting and alternate day fasting, which are fasting on some days of the week and not other days of the week. And then there are also fasting mimicking diets. So the research in the oncology space is still quite limited. What the research does show is that fasting around chemotherapy may be beneficial for reducing side effects. And this could be as short as 24 hours before your chemotherapy infusion, up to say 96 hours before, during, and after chemotherapy. The theory is that this protects the healthy cells that we want to protect from the systemic damage from the chemotherapy, while impacting negatively the cancer cells. And research has shown that fasting can improve quality of life and fatigue around treatment periods. Fasting may also lead to decreased tumor growth. The theory here is that fasting deprives these rapidly growing cancer cells of nutrients and growth factors that they need to grow and perpetuate, which makes them more susceptible to the cancer therapy and increases cell death. There are a couple studies showing that fasting around 13 hours, which is, say, from like 7 p.m. to 8 a.m. the next morning, may reduce the risk of breast cancer recurrence, and other studies showing that there may be improvements in progression-free survival with fasting. The caveats here are that studies have been mostly limited to smaller groups of patients, so not large groups, and also mostly with breast or prostate cancer, so not applicable across the board. We know that fasting is not appropriate for all of our patients by any means. One thing that we worry about is that fasting, which is limiting the total amount of energy or calorie intake that you're taking in a certain period, can contribute to unintentional weight loss and cachexia, which is a muscle wasting disease that's quite prevalent in cancer patients undergoing treatment anyway. And so we are always working to prevent malnutrition in patients. And so we consider fasting to be a risk for this weight loss and cachexia in certain groups of patients. We also know the research does not show yet that this works with all types of cancer or with all treatment types. So again, it's not applicable across the board. And we do have to consider other comorbidities or other diseases or chronic diseases that a patient may have. For example, if a patient has diabetes and is on insulin, we need to consider how fasting may impact their blood sugar levels and whether that. Bottom line with fasting is that there really is not enough evidence to support fasting protocols. We need to consider closely individual circumstances and the whole picture of each individual before supporting a fasting protocol on patients. And if fasting is occurring, we need to monitor those patients closely for any negative side effects, monitor their lab values, and how they're tolerating it.
Yeah, so with that, I would just obviously encourage all the patients to check with their providers before they think about starting fasting on their own. Yeah.
Yeah, absolutely. Absolutely. All right. Soy and cancer is another really common question that we get. And this stems from some research that is kind of decades old, but this myth has perpetuated that soy products increase the risk for hormone-sensitive cancers and should be altogether avoided. So the science behind this is that isoflavones are compounds in soy products that have a similar chemical structure to the naturally occurring hormone estrogen in our bodies. They're called phytoestrogens or plant estrogens. And we know that high levels of estrogen can increase breast cancer risk. So initially, there was a fear that these foods, these phytoestrogens, may increase risk. But these studies were done in mice, and what we have learned since is that rats and mice metabolize these phytoestrogens very differently than humans. So the newer studies have disproven this recommendation to avoid soy and actually have flipped it all the way to the other side of the pendulum to indicate that soy may actually be beneficial for cancer risk, even for hormone-sensitive cancers such as breast and prostate cancer, and may also be beneficial if you already have cancer. So one study shows that soy may have a synergistic effect with tamoxifen. In other words, it may actually make tamoxifen more effective in our bodies. As little as less than 1 serving per day of soy, and this would be equivalent to about a cup of soy milk or 3 ounces of tofu or about a half a cup of edamame, that this may reduce the risk of recurrence of breast cancer. So just as an example, 1 cup of soy milk has 25 milligrams of these isoflavones, and anything above 10 milligrams is linked to this reduced risk for breast cancer. So it really is a small amount of soy that can be beneficial. Soy intake is also associated with reduced risk for prostate cancer and also lower risk of progression in patients who already have prostate cancer. There are myriad other benefits of soy as well. It's an excellent plant source of protein, which Carol's going to talk about later, an excellent source of fiber, which Carol's also going to talk about. Soy also contains omega-3 fats, which are the anti-inflammatory fatty acids that we think of found in salmon, but these are also present in soy products. And then soy contains various vitamins and minerals, some of the notable ones being iron, calcium, and potassium. Bottom line here is that not only is soy okay to eat, but it can actually be beneficial for cancer. What we recommend is choosing whole soy foods, soy milk, tofu, edamame, and tempeh, and avoiding or limiting high-dose soy protein supplements just because we don't have enough research on how those isolated supplements function in our body. And then the last topic that I'm going to briefly discuss is dairy and cancer. The myth here is that hormones used in the production of milk increase hormone-related cancers. And I'm going to start basically with the bottom line here, which is that the scientific link between cancer and dairy is inconclusive. So there just really is not enough research. And the research that we do have is rather contradictory. So I'll give you a few examples here. In colorectal cancer, studies suggest that milk may reduce the risk of colorectal cancer, perhaps due to vitamin D, which higher levels of vitamin D can be associated with lower risk of cancer. Also butyrate and high amounts of calcium, Whereas with prostate cancer, diets high in calcium that include dairy can be a probable cause of prostate cancer. And with breast cancer, it goes both ways. Some studies have suggested that dairy is linked to an increased risk of breast cancer, and some have shown that it's linked to a decreased risk. So you can see it's quite complicated and quite specific based on the cancer type. I do want to say that dairy does provide a significant source of certain nutrients that can be especially important. Protein is especially important in the cancer picture, and also as we age, for maintaining muscle mass. And then it's also a good source of calcium and vitamin D, which can be important for patients who are at risk for osteopenia or osteoporosis due to certain cancer treatments. Again, bottom line, we just don't have enough evidence to prove that dairy should be avoided. But for those who are concerned, we recommend limiting dairy to 2 servings per day. And again, a serving here would be about 1 cup or 8 ounces of milk or yogurt, or 1 ounce of cheese. And with that, I will hand it over to Carol to talk about the ketogenic diet.
Thanks, Ashley, and thank you, Shalu, for the wonderful introduction. So we're moving on to the relationship between the ketogenic diet and cancer. And this myth here is that the ketogenic diet may starve all types of cancer cells. And this is usually a second question or a follow-up question to the sugar and cancer connection question. And I think the idea that we can starve cancer completely really undervalues how complex cancer is. However, I think there are some important points here to address about the ketogenic diet. So the definition of the ketogenic diet is a very high fat, low to moderate protein, very low carbohydrate eating plan. So it's usually like less than 40 grams of carbohydrate in a day that you'd be eating. And this diet aims to induce the metabolic state called ketosis, where the body's using fat as the primary fuel source instead of carbohydrates. This diet causes, as Ashley mentioned earlier, the body to break down fat into molecules called ketones, which circulate in the blood and become the main source of energy. So the facts here are that there is some evidence that the ketogenic diet might be beneficial for slowing tumor growth in aggressive brain tumors, specifically glioblastoma. It can be really hard to implement and maintain this diet due to how restrictive it is, with that less than 40 grams of carbohydrate, sometimes 20 grams of carbohydrate per day, which is the version of the ketogenic diet required to actually reach therapeutic levels for cancer. So on this diet, that's usually people are on it in combination with the standard of care for glioblastoma. It also becomes challenging because the diet is so satiating, and the treatment also makes people not feel well. So it can be really hard to get in enough total calories and enough protein to maintain not just weight, but especially muscle mass. And the ketogenic diet can potentially accelerate the muscle wasting disease called cancer cachexia. So that's something that we are always thinking about when people want to try going on this diet. There's also possible nutrient deficiencies that can occur on the ketogenic diet. So we really do like to try to work with people to make sure that they are really eating an optimal version of this diet if they're going to try it as a therapeutic diet. But the bottom line here really is that there have not been any large studies in humans yet. So we don't know for sure if and how the ketogenic diet might work against cancer. There is a lot more research coming down the pike, especially for glioblastoma. So I just want to address this little schematic that comes out of the Journal of the American Medical Association Oncology from 2022. So we're going to talk about the right side of this schematic that addresses the ketogenic diet, and the left side is the whole food plant-based diet that we're going to address next. So the ketogenic diet here in the blue really has one mechanism listed under it that is different from the whole food plant-based diet. So the purple boxes represent the mechanisms that are at play for both diets, where there's similar mechanisms with each diet. And then when we talk about the whole food plant-based diet, the green boxes represent mechanisms that are different. So for the ketogenic diet, the ketone body and short chain fatty acid called beta hydroxybutyrate is potentially able to decrease inflammation and cause cancer reduction. However, there is a bit of a paradox with this ketone body where beta hydroxybutyrate can suppress the growth and metastasis of several cancers from the research, and possibly enhance effects of certain cancer chemotherapies. However, the big caveat here is that it might have the potential to fuel cancer cells too, where beta hydroxybutyrate can fuel breast cancer stem cells, which could contribute to metastatic growth. So that is something that we wouldn't want to happen, of course. And then the other possible mechanisms under the ketogenic diet are reducing circulating glucose, blood sugar levels, which might actually be beneficial for people who have certain mutations called PI3 kinase mutations, who might be put on drugs that cause a really elevated blood glucose. So the ketogenic diet might actually be helpful. So it might reduce blood glucose and then also reduce circulating insulin, which might reduce cancer as well. The last mechanism is that the ketogenic diet, as I mentioned before, can be really satiating. So it might end up reducing body weight in that way. So we can move to the next topic, which appropriately is the whole food plant forward diet. So the myth here is that there is a specific diet that can cure or prevent cancer. And the facts are that we know from a lot of research and data that eating a mostly plant-based diet consisting of whole grains, vegetables, fruits, nuts, beans, and legumes can play a really big role in cancer prevention, and contribute to health in general. And that there's no diet that ensures you will not get cancer, and there's no proven diet to actually cure cancer. So this brings us to the body of work that's presented by the World Cancer Research Fund and the American Institute for Cancer Research, where they have taken all of the research on cancer and lifestyle and really sifted it down to these big lifestyle recommendations, which we encourage you to go visit the American Institute for Cancer Research's website. But the big nutrition takeaways from these recommendations are to avoid added sugar and heavily processed foods, avoid processed meat, and limit red meat to about 12 ounces a week, and to eat more whole grains, vegetables, fruits, nuts, beans, and legumes. So I think this is the piece, with going back to what Ashley said, that is more simple when it comes to nutrition, eating whole foods the way that they're closely look in nature. So whole grains, vegetables, fruits, nuts, beans, and legumes, which play a big role in our gut health, which we're going to talk about in a couple minutes as well. So if we go to the next slide again, we're talking about the whole food plant-based diet on the left. So to address the mechanisms that are impacted just by eating a whole food plant-based diet, we know that this diet really increases the amount of fiber that we get from our food, right? So fiber is the part of plants that is undigestible, that feeds all the good microorganisms in our gut. And this fiber can also decrease intestinal transit time, which decreases fecal mutagen time. So the time that our feces are interacting with colon mucosa, that might reduce cancer. There's also these short chain fatty acid called butyrate. We really love butyrate producers in the gut. These short chain fatty acids decrease inflammation and can reduce cancer in that way. And then going back to what Ashley said, these phytochemicals that come from our plant foods. So these bioactive substances in our plant foods that aren't vitamins and minerals and fiber, that have all these amazing properties and roles in cancer prevention and prevention of other chronic diseases. So if you're eating a lot of plants, you're going to be incorporating a lot of different phytochemicals. And then, of course, if you're eating a plant-based diet and you're eating a lot of fiber, and it's lower calorie, that can lead to weight loss as well, which might decrease inflammation. And then eating this way also might decrease blood glucose levels, which is confusing to some people, thinking that if I'm including whole grains and fruits, how could that possibly decrease blood glucose levels? The overwhelming amount of research that we have shows that eating more plants can decrease blood glucose and therefore decrease insulin levels as well, and decrease this insulin-like growth factor, which is another factor in encouraging cancer growth. So multiple more ways, we would argue that the whole food plant-based diet can possibly suppress cancer growth compared to the ketogenic diet. We go to the next slide, we're going to talk a little bit more specifically about the gut microbiome. So what is the gut microbiome? The microorganisms that are in the gastrointestinal tract that provide nutrients and vitamins, protect the body from pathogens, and modulate the function of the immune system, which is pretty cool. So these good bacteria that produce butyrate, these short chain fatty acids that have anti-inflammatory effects, might be really impactful in the prevention and also during the treatment of cancer and then in cancer survivorship. So we do have research in the blood cancer, multiple myeloma, showing that the gut microbiome may play a role in the progression of monoclonal gammopathy of undetermined significance, or MGUS, the precursor to multiple myeloma. The gut microbiome can impact the tumor immune microenvironment, immune cell recovery, and treatment outcomes in multiple myeloma, which is very cool. And then we do have evidence in patients with advanced melanoma as well, who are on immunotherapy with immune checkpoint blockers. And in this group of patients that were studied, the patients that were consuming 20 grams of fiber a day actually survived the longest without their disease progressing, which is awesome. And then in contrast, in the same study, they looked at people using over-the-counter probiotics, and those who were using probiotics actually appeared to lessen the effectiveness of the immune checkpoint blocked regimes. So I think that's a really good point to, because this question always comes up about if probiotics could be helpful for gut health, and we don't have a good answer yet, especially when we have some science showing that they might actually lessen the effectiveness of treatment. I think we have to be really careful in trying to better understand if probiotics are going to be helpful, have a null effect, or maybe even be detrimental. Another thing that I wanted to mention, just to tally up, like, what does 20 grams of fiber look like? We don't even really consider that a super high fiber diet. I would consider that like a moderately high fiber diet. So 20 grams of fiber would look like an apple being 4 grams of fiber, a cup of berries equaling 8 grams of fiber, a quarter cup of almonds equaling 4 grams of fiber, and then a medium sweet potato with the skin having about 4 grams of fiber. So those 4 foods would give you about 20 grams of fiber. So definitely not a high fiber diet that we would say is maybe around 40 grams of fiber. So the bottom line here is a whole food, plant-based diet, high in fiber, can increase the number of beneficial microorganisms in the GI tract, which might help with cancer, but certainly contribute to health in multiple other ways as well. So we can go to the next slide, which is giving you just a visual as to how you could get your plate to look. So all the way on the left, the stage 1 is an example of kind of the old American plate, where about a third of the plate is some red meat, a third of the plate is some potato with some butter on it, and then the other third of the plate is peas, which The peas and potatoes are both vegetables, but they are starchy vegetables. They're a little bit higher calories. So if we're progressing to the second plate, you can see that a third of the plate is green beans, which are a non-starchy vegetable, so helping to decrease the overall calories of the meal and keep the fiber high. And then a third of the plate is some brown rice that's topped with some parsley, which herbs and spices have some pretty powerful anti-inflammatory properties as well. And then another quarter of the plate is just the meat being a little bit smaller, about half the size as the original plate. And then on the third plate, you can see you're just like overwhelmed with color. Most of the plate is vegetables. A quarter of the plate is still a carbohydrate source of quinoa, which is high fiber, high protein. And then even the chicken is really smothered in some spices. So a very different plate all the way on the right that's got a lot of different colors and phytonutrients compared to that first plate. And then if we move on to the next slide, I just wanted to point out all of the different sources of plant protein. I think Ashley and I would both argue that a diet that incorporates a lot of plant proteins, especially from things like beans and potatoes and edamame, can actually be even more budget friendly than a diet that's high in animal protein. So I just wanted to use this slide to point out that there are so many different sources of plant protein, and you can get so much good variety to really feed your gut microbiome and increase the diversity of your gut microbiome from all these different plant sources of protein. I think there's 16 different sources of plant protein listed here. So then we have this tagline from the plant writer, my gosh, the food writer, Michael Pollan. It's an older book, but the tagline still holds up: eat food, not too much, mostly plants, which simple. And it doesn't seem so simple since we've had to present 23 slides on the complexity of these questions. So last section here is just, where does your nutrition information come from? And I think asking yourself this question when you're reading something can be really helpful, although still complicated with the prevalence of social media and anyone having access to social media. I think this can still feel really confusing and overwhelming, but at least starting with these questions can be helpful. So first, does the website seem biased? Are they trying to sell something? These are two really important questions to point out any red flags. Is it too good to be true, right? Like, if it sounds too good to be true, it probably is. Like, we have to think about our bias as humans, right? Like, one being red wine, right? Like the resveratrol in red wine pops up every now and then, and how beneficial the phytonutrient resveratrol might be in red wine, where we know when it comes to cancer, alcohol is a carcinogen, and alcohol actually isn't recommended at all. So just one example of this idea of something being too good to be true. And then looking for information from a reputable cancer organization that's really based on research is helpful, and checking the credentials of where the information is coming from as well. Registered dietitians are considered the experts in nutrition because of our level of training. And then specifically in the cancer area, a board certified specialist in oncology, someone who has the CSO credential, is also considered an expert. And then this next slide, we have a bunch of different resources, and these are pretty much the resources that we have on our website too. So we do have a Cancer Center Nutrition Services website and phone number there if you wanted to make an appointment with one of our registered dietitians. If you are a patient of MGH, we can see you. And the resources here are the American Cancer Society, the American Institute for Cancer Research, and then also a few books. So 2 books by Rebecca Katz, The Cancer Fighting Kitchen, and One Bite at a Time, and then Foods That Fight Cancer still holds up, an older book too. And then we have many of our references listed. And we didn't even really take that deep of a dive into each section, but we wanted to make sure we brought some of the science, since that's our whole bag is providing evidence-based information. We'd love to take questions if anyone has them.
That was fabulous. That was such a wealth of information. Definitely I hope a lot of people get to watch this, because those questions are such common ones that always come up. And that was really helpful to have that evidence-based information. Thank you both. So we have one question that just came in. I have a hard time figuring out which brand of soy milk to get. Ditto with oat milk and other non-dairy milks. There seems to be so many different variables to weigh. And are there brands of soy milk that you recommend, other non-dairy milks that you recommend?
I can take that. Yeah, that's a great question. And it's a question that we get a lot, because there are an increasing number. I feel like every time I go to the grocery store, there's a new plant-based milk or a new version of them. I think if you're looking for a dairy alternative, there are a couple things to look for. I wouldn't say that the brand matters as much as looking at the nutrition facts panel. So for example, soy milk, which is one of my favorites, and I know Carol's too from talking about this, is much higher protein than, so it's comparable to cow's milk protein wise, like 7 grams per cup versus 8 grams per cup in cow's milk. Whereas oat milk has anywhere between 2 to 4 grams per, depending on the brand, per cup, and almond milk has none or maybe 1 gram of protein per cup. So just to give 3 different examples there. And if we're trying to get increased protein, I prefer soy milk and will recommend that if we're trying to increase the protein in our diet. The other thing that perhaps, or that's just as important to look at, is a lot of the dairy-free milks are high in added sugars. And so again, looking at that nutrition facts panel that I showed you and going down to the added sugars, and then looking for either a brand that has an unsweetened one, or looking for an unsweetened version of any of those dairy milks.
That's great. Thank you. So there is a question here on alcohol and the evidence behind it being a carcinogen. An article, Carol, that you just posted, and I'm not sure everyone can see this webinar chat, but is that article referring to?
Yeah, that's from the American Institute for Cancer Research's section on alcohol and cancer.
So I wonder if I could maybe post that on our open, I guess, answer chat, because everyone else can see that, I believe. Can everyone see the webinar chat?
Yeah.
I think, yeah. Oh, okay. All right. So then that's answered. And then I also heard from the MGH that sesame and flax seed is not good for breast cancer patients. Could you explain safe levels?
So we can definitely address the flaxseed. I think sometimes flaxseed is recommended to not take with your medications because it can decrease the absorption of some medications. But ground flaxseed is definitely a food that I usually recommend for patients with a history of breast cancer. There's a lot of great health benefits of ground flaxseed, and it doesn't really taste like a lot, but it's really easy to add to a whole grain breakfast on top of avocado, on top of salads. It's packed with those omega-3 fatty acids, the plant versions of the type of fat that's in salmon. So there is actually some research on positive effects of ground flaxseed on breast cancer. So I'm not sure maybe where that information came from. And sesame actually is a really great source of plant-based calcium. So I actually love using tahini actually in different sauces and dressings for vegetables and salads.
It sounds delicious. I'm getting hungry just thinking about it. So I have a question on your guidance on consuming oats. I've been hearing some more negatives lately.
Go for it, Ash.
So I guess that's a pretty broad question. I'm not sure exactly what the
Yeah,
ref
Is it a
what the negatives would be. Yeah.
the reference to the negatives. I mean, as far as like contamination or gluten-free or but generally we recommend oats as an excellent whole grain, good source of fiber, especially soluble fiber, which is one of the two different types of fiber. It has some iron, some vitamins, some minerals in it. So yeah, I would say, I would think that the negative effects of it maybe more media taking things out of context, or I don't know, Carol, do you have any other thoughts on like the possible negative
No, just more
implications?
positives, right? Like that heart health claim that oats can help lower cholesterol is real, right? That soluble fiber can pick up some LDL cholesterol and help with hyperlipidemia. So I can't think of negatives right now.
Yeah, so you may have already said this, Ashley, but I'm just thinking about some of those instant oats I see on, the supermarket that are flavored with maple honey, and those definitely a little bit more added sugar. So I probably wouldn't sort those out just because of the
Yeah.
added sugar.
Yeah, that's a great point. That's a great point. I mean, ideally, I would say, yeah, if we're kind of ranking things, like
Right.
maybe a whole steel cut oat, the closest you get to the whole
Yeah.
source of the food, the better. Instant oats being slightly more processed, but that's on a large scale. It's a very small part of it. I do think the added sugar piece is important, that if you're doing those instant packets that are like peaches and cream or the strawberry flavor or cinnamon apple, that those can add a lot of sugar into your diet. So that is something to consider there. Absolutely.
And then somebody else asked again about the alcohol answer, because I guess they're not able to see that chat. So I just posted it under the Q&A, the link to the article. I hope you're able to see that. But while we're waiting for more questions to roll in, I want to ask you a question that does come up for, like, my patients ask this all the time. A lot of people have a very hard time meeting their fiber requirements. And people often will go to fiber supplements. And, what are your thoughts? I mean, we all know, obviously, eating food is obviously better than taking in supplements. And I just want to just hear from the two of you, like how you advise your patients around that.
Yeah, I think it depends on what's going on. I mean, we're always going to try to figure out ways to get people to reliably every day increase their fiber intake. But if you have something that's going on related to treatment, that where your diet is varying like week to week, day to day, and adding a soluble fiber supplement is going to help with like loose stools or constipation, then that might be a time that we would add a fiber supplement. But I think if you're otherwise feeling well, we'll always encourage the food first route.
That's perfect. That's what I would have thought. Yeah. So
Yeah,
there's a
I
couple of
agree
other
with that.
questions. Is turmeric safe to consume? And I know it's healthy, but it on the list of foods, it increases estrogen that I was provided.
A list. I think in terms of supplements. So, right, turmeric is not recommended to take in supplement form with certain medications. That's definitely true. But then eating turmeric in foods and in curries as a spice is okay to do, because you're not going to be getting nearly the same amount when you're eating it at a meal versus in a supplement.
Yeah, absolutely. Good point. And then should oats be organic due to pesticides?
The organic question is, yeah, one that we get a lot. That's a very common question. And, the research on pesticides is really not sufficient to show that the amount of pesticides that we're getting is going to increase cancer risk or have us, play a significant role or have a significant effect. What I usually tell people is, there are certain foods that, if you can buy organic, it may be worth buying organic, but the organic foods are very expensive. And so that's not a realistic option, particularly, for example, organic, like fruits or berries. So, as with anything, I think just being mindful, and I don't think that it's necessary. Basically, the benefit of eating these foods, even if they're conventional, and have some degree of pesticides, outweighs, any possible risks of the pesticides. And also, organic doesn't mean that they're not using any pesticides. It's just different chemicals that are allowed, basically different compounds that are allowed in there. So I think that's not a must in our book.
Yeah, I agree. And do you all, with Michael Pollan, like in his book, if you remember, there's the clean list and the dirty list. And I'm just forgetting, was it like clean 15 or something? Is that what it is?
Yeah, it's the dirty dozen and the clean
The dirty
15.
dozen, thank you. Yeah. So if you had to buy organic, I guess you could maybe that short list of things, if it's affordable, to rely on buying it organic.
Yeah, I'm on the fence on this one just because the research is mixed and
Okay. Good to know.
The dirty dozen list isn't accurate. They're just telling you how many different pesticides are on the food that was tested, not the quantity of pesticide.
Got it.
So yeah.
That's not reliable.
Yeah.
Okay. Good to know. Glad I asked. The other question that came up was again about asparagus, and if that could be just estrogen promoting.
Yeah, I think this is a good point, actually, not specifically about asparagus, just that all plant foods have a certain level of isoflavones, right? Like soy is the highest, flax is probably next, chickpeas, and then like all plant foods have some of these isoflavones that can be converted into this like phytoestrogen that Ashley talked about in the soy section. So asparagus definitely doesn't need to be avoided at all. In fact, I mean, asparagus, I think, has some anti-cancer properties. I mean, you could argue that all fruits and vegetables have something in them that can be argued that there is a anti-cancer property, which is also why we encourage variety in the diet, right? Because there's no one food that's going to make or break you.
Absolutely.
And I think along those lines, it's kind of what we try to get patients to focus on when we're getting asked some of these very specific questions is taking a step back. Because when you look at the compounds in foods, in every specific food, you could find some compounds that have beneficial properties and some that could be considered to have some sort of negative implication, right? But that's in isolation, and that's not considering what the whole diet looks like. And so what we talk about is trying to step back. Like Carol said, try to eat a variety, try to eat a mix. And so that you're not focusing only on one food or one group of food, or you're not avoiding specific foods, because the impact comes from the variety, the balance, the synergy between all those foods in your diet and the overall patterns that we know can promote health, prevent cancer, prevent chronic diseases.
That's an excellent point. And that, brings me back to the microbiome, because we don't know what specific microbiomes we have at our gut, because we're not there yet with precision medicine. So we don't have a way to tell people that you're going to need this particular type of fiber foods to actually promote good bacteria. And so going back to just eating a variety is extremely important, because we don't know exactly what our body needs. So I love that. So rainbows, rainbow.
Exactly. And that touches on the probiotic topic too, which is basically every talk I've heard from a researcher, doing this research on probiotics is that it is so individualized. Like you said, our gut microbiomes, we don't know there are millions of bacteria in there, and we don't know what I need versus what Carol needs versus what Shalu needs, and we'd have to do very individualized specific testing, which we don't even have the capacity to do right now to figure out exactly which strains and how much of different probiotics you would need. So it is very individualized, but when we step back, we do have evidence to show what the patterns are that can promote health.
Yeah, and we are at the top of the hour, but I want to just do the one last question. A lot of multigrains out there, and buckwheat seems popular at the moment. Do multigrain crackers count?
Go ahead, Carol. You love the Mary's gone.
There are some whole grain, multigrain crackers that I do like. Again, looking at the ingredient list to see what's in there can be really helpful. There's this old timey cracker called akmak. It's, I think, an Armenian cracker that I really like. The wasa crackers are really great. There's definitely others out there. Those are just the top two that come to mind when it comes to a whole grain cracker.
Yeah, so I guess looking at the ingredient list and hopefully have the fiber content on there and hopefully the whole grain stamped on there too. Yeah.
Yes. Thank you, Shalu.
Yeah. But that was great. Thank you both so much. There was so much enlightening information. I personally learned a lot too. So thank you for sharing.
Oh, thanks for having us. It's fun to talk about this.
Yes, definitely. And I'm getting hungry. So we'll let our participants get to their lunch.
Thank you, everyone.
Thank you for attending.
Thank you.